Hi everyone, I am Gauri PS, lecturer, Department of Radiology, Global College of Allied Sciences. Today we are going to discuss about the topic 3D or 4D sonography system. First is about introduction. What is 3D and 4D or sonography? 3D and 4D sonography are the advanced ultrasound imaging techniques that provide us the detailed visualization of the anatomical structures. First, what is 3D ultrasound? That is 3D ultrasound is that it produces the three-dimensional static images of the anatomical structures. Then what about 4D ultrasound? 4D ultrasound produces real-time 3D images. That is 3D plus at the same time. So these techniques is widely used in the studies of obstetrics, gynecology, cardiology, and in the case of radiology. Next we are going to look about the 3D sonography. That is, the 3D sonography is an imaging technique that will be occurring the multiple two-dimensional ultrasound images and reconstructs them into a three-dimensional image. Next is about 4D sonography. In 4D sonography, it is a real-time 3D imaging technique that will be continuously displaying the moving 3D images. Next is about the components of a 3D or 4D sonography system. First is about transducer, that is we can also say it as a probe. That is, it is a mechanical or a matrix array transducer that will be collecting the multiple ultrasound slices and converting these electrical energy into sound waves and by vice versa. That is by taking the sound waves into electrical energy and giving it to the computer system. Next is about the ultrasound console. That is, it will be controlling the image acquisition process. That is, signal processing and imaging reconstruction. Next is the computer workstation. That is, it will be storing the imaging data and it will perform the 3D reconstruction. It also allows the image manipulation, also measurements. Next is about the display monitor. That is, it will be showing the reconstructed 3D and 4D images. That is, it is showing about a high resolution display. Next is about storage system. The storage system consists of hard disk, packs, and cloud storage. That is, it will be helps us to save the images and also the video recordings of the imaging systems. Next is the principle of operation. What is the principle of operation in ultrasound? That is, the ultrasound waves are emitted into the body, which will be reflected as echoes and are received by the transducer probe. That is, multiple 2D images will be occurred from different angles. Next is, and the computer software will be reconstructing these images into a three-dimensional volume. The continuous volume acquisition will be producing the real-time four-dimensional images. Next is about the image acquisition method. What are the image acquisition methods? That is, first is about freehand scanning. In freehand scanning, the operator will be manually moving the probe. That is, they will be moving with their own effort. That is, it will be simple, but we can't say it is an accurate process. Next is about mechanical scanning. What's mechanical scanning? In mechanical scanning, the probe will be automatically sweeping through the tissues. That does not require a manual process. It will be done automatically and the image will be better in quality comparing with the freehand scanning. Next is about matrix array transducer. In matrix array transducer, the electronic scanning will be taking place in multiple directions and it will be the fastest and it will be the most accurate method for calculating or for scanning process. Next is about the image reconstruction techniques. That is surface rendering. First is about surface rendering. That is, it will be displaying the outer surfaces which are useful for the fetal face imaging. Next is about volume rendering. In volume rendering, it will be showing the complete volume information, that is better tissue visualization. Next is about multi-planar reconstruction. That we also say it as MPR. That is, it will be displaying the images in sagittal, coronal, and transverse plane in a simultaneous process. Next is about the applications. Where do we apply these ultrasound? That is mostly in the case of obstetrics and gynecology. In obstetrics, we will be using it in the case of fetal facial abnormalities, cleft in lip and palate detection, fetal growth assessment, and then assessments of the fetal movement. In gynecology, we'll be using this in the case of uterine abnormalities, endometrial assessment, and ovarian pathology. In cardiology, we use it in the case of heart valve assessment, congenital heart disease evaluation, etc. In radiology, we'll be using it in the case of tumor detection, organ volume measurements. What are the advantages of this ultrasound is it will be improving the anatomical visualization, better detection of congenital abnormalities, real-time fetal movement observation, accurate volume measurement, and enhanced patient understanding. What are the limitations? The limitations will be about expensive equipment and required skilled operators. It also takes longer processing time. It will be reduces the image quality in obese patient. And it will also cause motion artifacts. Okay, may also occur. Then what are the safety precautions we use? Actually, it will be using a non-ionizing ultrasound waves. So it is mostly considered safe, but when used inappropriately, it may cause any damages. It also strictly follows the principle of ALARA, that is as low as reasonably achievable principle. And next is the label diagram. This displays about the proper system. That is, first is about the display monitor, next the computer image processor, next the ultrasound console, then 3D or 4D probe, that is a transducer, and next is about the patient. So from this we can conclude that the 3D and 4D sonograph systems are the advanced ultrasound technologies that will be providing the detailed anatomical visualization and also about the real-time imaging. And this plays a significant role in obstetrics, gynecology, cardiology, and diagnostic radiology by improving the diagnostic accuracy and patient care. So that's all for today's topic. Thank you.